I'm going to talk about 12 vitamins and minerals everybody needs, but especially people with diabetes or pre-diabetes. As we get older, our bodies absorb vitamins from food poorly. People with diabetes often have lower levels of vitamin D, magnesium, and vitamin B12 than they should. Vitamins are broadly classified as either water-soluble or fat-soluble, based on their solubility and how the body absorbs and stores them. Water-soluble vitamins, like vitamin C and the B-complex vitamins, B1, B2, B3, B5, B6, B7, B9, and B12, dissolve in water and are not stored in the body, meaning they need to be replenished regularly or every day. Fat-soluble vitamins, A, D, E, and K, dissolve in fat and are stored in the body, primarily in the liver and fatty tissues. But there is some version of vitamin B1, which are fat-soluble, called benfotiamine, which is very important for people with diabetes. Number 1. The vitamin D content of caged chicken eggs and mushrooms grown inside grow houses is doubtful. They both need sunlight exposure to make vitamin D. DV, or daily value required, you see, in general, advice is the minimum level you require to avoid deficiency symptoms. But most of the time, you need much more than that to get health benefits. There is no argument. Natural foods are the best source, but I do back that with taking the right supplements as well. Most of the time, it is cheaper to take a supplement than to check the blood vitamin level. It can make a big difference in how you feel and how well you manage your diabetes. Let's look at 12 important vitamins and minerals that can help lower your blood sugar and make living with diabetes easier. Each one helps your body in different ways. Some make insulin work better. Others fight damage to your body. All of them can be part of your plan for better health. Many people with diabetes don't have enough vitamin D in their bodies. This vitamin helps your body use insulin better. It does this by helping your cells respond to insulin better. It works in several ways. First, it increases the number of insulin receptors on your cells. More receptors mean insulin works better. Second, it reduces inflammation in your body. Reducing inflammation can make insulin work better as well. Third, it helps maintain the right calcium levels. Your body needs calcium to release insulin. Studies show taking vitamin D can lower your A1c levels. This is a measure of your average blood sugar over 3 months. It can also reduce how much insulin you need. How much should you take? If you're between 9 and 70 years old, 600 IU daily is recommended. If you're over 70, you need a bit more, about 800 IU daily. Getting your vitamin D levels checked is a good idea. Your doctor can tell you if you need more or less. Many diabetics have low vitamin D levels without knowing it. Fixing this can help your blood sugar control get much better. Number 2. Chromium is a mineral that many people don't know about, but it's very important for blood sugar control. It helps insulin work better in your body in several ways. Chromium improves how insulin receptors work. It helps move glucose into your cells where it belongs. It also makes cell membranes more flexible, which helps insulin work better. Clinical studies show that taking chromium can lower your fasting glucose levels. It can also reduce your HbA1c or A1c, which measures your average blood sugar over time. Wait, there is more, but do not forget to hit the like button if you think this video is useful. The suggested amount is between 200 and 1,000 micrograms per day. The form called chromium picolinate seems to work best. Many studies have looked at the effects of chromium. Most research shows it can significantly improve blood sugar control. If you're diabetic, adding chromium to your daily routine might help your cells respond better to insulin. This can lead to better blood sugar numbers when you check them. Vitamin E is a powerful antioxidant. This means it fights damage in your body caused by high blood sugar. Diabetes causes something called oxidative stress. Number 3. Vitamin E helps reduce this stress. This vitamin improves how well your cell membranes work. When membranes work better, insulin signals get through more clearly. It also protects your liver, which is important for glucose metabolism. Research shows taking vitamin E significantly improves HbA1c levels. It also helps with insulin resistance and lowers fasting insulin levels. The typical amount used in studies is between 600 and 1,200 IU daily. Taking vitamin E regularly can help delay the start of diabetes complications. It can also slow down complications you might already have. Vitamin E is especially helpful for protecting your blood vessels. Since diabetes can damage blood vessels, this protection is very important for long-term health. But avoid taking high doses of vitamin E, especially if you are taking blood-thinning medication. Number 4. Vitamin B12 is crucial for nerve health. Many people with diabetes develop nerve problems over time. These problems can cause pain, numbness, or tingling in your hands and feet. If you take metformin, a common diabetes medication, you're more likely to become low in B12. Studies show that many diabetics on metformin develop B12 deficiency. This can make nerve problems worse. Taking B12 supplements can help improve symptoms of diabetic neuropathy. This means less pain and better nerve function. The amount you need depends on how low your levels are. Your doctor can test your B12 levels and suggest the right amount. Keeping your B12 levels healthy is critical for preventing nerve damage. It's one of the simplest ways to protect your nervous system from diabetes-related harm. Number 5. Vitamin B1, also called thiamine, is extremely important for people with diabetes. Did you know that thiamine levels are 75% lower in diabetics compared to people without diabetes? This happens because your kidneys remove too much thiamine when blood sugar is high. Thiamine helps protect your body from damage caused by high blood sugar. It also prevents problems with your blood vessels, which are common in diabetes. Most people with diabetes benefit from taking 50 to 100 milligrams of thiamine daily. This can help reduce the risk of serious complications like eye problems, kidney disease, and nerve damage. Thiamine is one of the most overlooked vitamins for diabetics, but it's one of the most important. Making sure you have enough can make a big difference in your long-term health with diabetes. Thiamine is water-soluble, so you need to take it almost daily. There is a form of vitamin B1 called benfotiamine, which is especially beneficial. It might help conditions like diabetes-related nerve damage, Alzheimer's disease, and alcohol dependence. Benfotiamine, a type of vitamin B1, may offer benefits in managing Alzheimer's disease. Number 6. CoQ10. Coenzyme Q10 is a compound your body makes naturally, but people with diabetes often have lower levels. CoQ10 helps improve blood sugar control by lowering fasting glucose and HbA1c levels. Studies show significant improvements in blood sugar numbers when diabetics take CoQ10. It works as an antioxidant, fighting damage caused by high blood sugar. It also helps your cells produce energy more efficiently. The typical dose is between 100 and 200 milligrams daily. Many people notice improvements in energy levels when taking CoQ10. This can be especially helpful if you feel tired often due to diabetes. CoQ10 also supports heart health. This is important because diabetes increases the risk of heart problems. Taking CoQ10 regularly can help protect both your blood sugar levels and your heart. Number 7. Magnesium is a mineral that's vital for over 300 processes in your body. But up to 38% of people with type 2 diabetes have low magnesium levels. This is a big problem because magnesium directly affects how insulin works. Taking magnesium supplements can enhance insulin function. This leads to significantly lower blood sugar levels. Research shows improved insulin sensitivity and better glucose metabolism with adequate magnesium. The recommended amount is 250 to 350 milligrams daily. Magnesium comes in different forms. Magnesium citrate and magnesium glycinate are usually easiest for your body to use. Low magnesium directly impacts insulin's ability to work properly. By bringing your levels back to normal, you can improve how well your body handles sugar. This makes magnesium one of the most important supplements for diabetes management. Number 8. Niacin, or vitamin B3, primarily helps with cholesterol levels in people with diabetes. It can reduce triglycerides by 23 to 28% and increase HDL, good cholesterol, by about 29%. This is important because diabetes often causes unhealthy cholesterol levels. One thing to know about niacin, it may cause a small increase in blood sugar levels at first, but this effect usually goes away with continued use. For many people with diabetes, the benefits for heart health outweigh this temporary effect on blood sugar. The amount varies, but it's typically between 500 and 1,000 milligrams daily. It's very important to take niacin only under medical supervision. Your doctor needs to monitor how it affects both your cholesterol and your blood sugar. Niacin can be especially helpful if you have diabetes and high cholesterol, but it's not right for everyone. Talk to your doctor about whether niacin might be a good addition to your supplement routine. Number 9. Selenium works as an antioxidant in your body. This means it protects your cells from damage caused by high blood sugar. Oxidative damage is a major problem in diabetes. Selenium helps fight this damage. Studies show that when selenium is combined with other minerals like zinc, it significantly reduces diabetes-related damage. It can also help lower blood glucose levels. Most people take between 55 and 200 micrograms of selenium daily. One interesting thing about selenium is that it works best with other antioxidants. It's like a team player that helps vitamin E and other nutrients work better. Selenium is found in foods like Brazil nuts, fish, and eggs. But many people with diabetes benefit from making sure they get enough through supplements as well. This can help reduce the long-term complications of high blood sugar. Number 10. Zinc is a mineral that has direct effects on blood sugar. It reduces how much glucose your body absorbs. It also reduces how much glucose your body makes. At the same time, it helps your body use and store glucose better. Research shows zinc enhances the activity of key enzymes involved in glucose metabolism. These include enzymes like alpha-glucosidase, PFK, PK, and glycogen synthase. By affecting these enzymes, zinc helps control blood sugar levels. Most studies use between 15 and 30 milligrams of zinc daily. Taking zinc supplements has been shown to reduce fasting blood glucose, post-meal blood glucose, and HbA1c in people with diabetes. Zinc is also important for immune function. Since people with diabetes are more prone to infections, getting enough zinc is doubly important. It helps with both blood sugar control and fighting off illnesses. Number 11. Alpha-lipoic acid, ALA, is a powerful supplement for people with diabetes. It works as an antioxidant. It improves insulin sensitivity. And it's especially good for diabetic neuropathy, the nerve pain many diabetics experience. Studies show improvement in nerve conduction and symptoms of neuropathy after just 12 weeks of taking ALA. Patients often report less pain, numbness, and tingling in their hands and feet. The typical dose ranges from 600 to 1800 milligrams per day. Research suggests 600 milligrams is the maximum effective dose for most people. Taking more doesn't always give better results. Alpha-lipoic acid is particularly good for relieving the nerve symptoms of diabetes. If you have pain, burning, or numbness in your feet or hands, this supplement might help you find relief while also helping with blood sugar control. Alpha-lipoic acid is synthesized in the mitochondria and is a cofactor in the enzymatic nutrient breakdown. It is also available in broccoli, beets, carrots, potatoes, spinach, and red meat. Number 12. Cinnamon isn't just a spice for your food. It's also a powerful supplement for blood sugar control. It works especially well for people with prediabetes and those who have diabetes with obesity. Recent studies show cinnamon supplements can help reduce blood sugar levels. Cinnamon has antioxidant, anti-inflammatory, and anti-diabetic effects. All of these help your body manage blood sugar better. Most people take between 1 and 6 grams of cinnamon daily. Make sure it is the Ceylon cinnamon, as the other versions may have some bad side effects. You can add it to your food or take it as a supplement. Either way can help with blood sugar control. Cinnamon is one of the easiest and most pleasant supplements to add to your routine. You can sprinkle it on oatmeal, add it to coffee, or take it in capsule form. It's a simple addition that can make a real difference in your blood sugar readings. Omega-3 fatty acids help control blood sugar levels and improve cholesterol in people with diabetes. They're known for their positive impact on health. They can reduce cardiovascular events and death linked to diabetes. People with diabetes are encouraged to include fatty fish and foods high in omega-3 twice a week. You can also take fish oil supplements to get enough omega-3s. Omega-3s work through several mechanisms. They have antioxidant effects, fighting damage in your body. They reduce inflammation, which is higher in people with diabetes. They improve cholesterol levels. And they have direct anti-diabetic effects. Including omega-3s in your diet or supplement routine can help with both blood sugar control and reducing the risk of heart disease. Since heart disease is the #1 complication of diabetes, this protection is very valuable. Taking supplements can help manage your diabetes better, but always talk to your doctor first. Everyone's body is different. What works for one person might not work for another. Your doctor can help you choose the right supplements for your specific needs. These vitamins and minerals can be powerful tools for better health. Used wisely, they can help lower your blood sugar, prevent complications, and make living with diabetes easier. They work best alongside proper diet, exercise, and any medications prescribed by your doctor. Living with diabetes is challenging, but with the right tools, including these supplements, you can take control of your health and feel your best every day. Do not forget to click the like button and subscribe. On the screen, you see an essential video for you. Thanks very much for watching this video. See you in the next video.